Hi, I'm Dr. Julie Steinauer. Let's talk today about something that's kind of a serious topic, which is that May is Stroke Awareness Month. Now, before we go into that, I want to tell you how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You'll have two choices. You can either schedule a consultation time directly with me, or you can click on the questionnaire and fill that out. And then at the end of it, if you provided your email, we'll send you your results, and then you can decide if you'd like to go forward with a consultation. Now, Stroke Awareness Month, let's talk about some signs and symptoms of a stroke. Many of them you may have heard of before. If there's like a drooping of the face, the eye, the mouth, tingling or numbness on one side of the body, difficulty with speech like slurring words or trouble coming up with words, maybe the language is just kind of everything's garbled or confused, general disorientation or confusion as to where a person is at, those can all indicate a stroke. So can all of a sudden having a problem and falling down or losing the ability to be bodily coordinated. Another one is more vision related. So problems with vision like eyesight suddenly blurring out in one or both eyes, kind of a waviness or distortion to what you're seeing, or experiencing double vision all of a sudden. Those are all things to look out for, which could indicate a stroke. Now there are others, and obviously this video is meant to point you in the direction of being aware of them and maybe go look and do some research on your own to find out what are all the symptoms of strokes. But we covered most common ones. Now let's talk, there's three different types of strokes. One type of stroke is hemorrhagic, which is where there is a brain bleed. This is typically going to occur after some sort of traumatic incident, maybe a trauma or a head trauma or a car accident or something where there's a hemorrhage inside of the brain or between the skull and the brain. Another type of stroke is called a TIA or a mini stroke, which is a transient ischemic attack. We're going to talk more about that in a minute. And then there's an ischemic stroke, which is where there's a blockage of a blood vessel, some sort of a clot. And when that blood vessel gets blocked, depending upon how long it's blocked for, it can cause the tissue, the brain tissue in that area that's not getting any blood supply to die off. And in a TIA, a little bit different. A transient ischemic attack is that this is one that's really tough to tell. You may not know that you've had a stroke. The person that you're with may not know that you've had a stroke, and your doctor may have a difficult time determining whether or not you've had a stroke. And these are mini strokes, and until it kind of tells us a little bit more, if you've had multiple, it's probably a little easier to figure out. But if it's preceding another thing, maybe a more serious type of stroke, definitely there's an indicator there that there's something going on very seriously. Obviously, in any instance where you think that you may have had a stroke or someone you're with is having one, get them or get yourself to the emergency room right away. Now, let's talk about what we can do if you have, at the end of a stroke, you have some vision loss or you happen to have double vision. If it's double vision, and so a strabismus is occurring where the eye is turning in a particular direction, you'll see double of everything. And we want to work to train your brain to signal the muscles properly to realign the eyes and gain binocularity and depth perception again. If you've had a visual field loss, we're going to talk about a couple of them, and one is a homonymous hemianopsia. In this particular case, if there's a stroke on the right side of the brain, there's a left homonymous hemianopsia. I've talked about this in other videos too. If there's a stroke on the left side of the brain, there'll be a right homonymous hemianopsia. Depending upon where in the brain has occurred, you could also have a quadranopsia, which can exist down in the inferior quadrant, or it can exist in the upper or superior quadrant of the eye. All of these things, obviously, whether it be strabismus and double vision or some sort of vision loss, that can be devastating. So let's talk about what we do to fix and correct that. All of our patients post-stroke will go through Syntonics and vision therapy. Now, they were going to go through some things very specifically, one of them being a healing filter or lens. And what it does, you can see it's kind of a bluish purple color, but this particular one is going to send blood flow back to the area of the brain that the stroke occurred in, and the blood flow may have been stopped. The idea being that if we can send blood flow back into that area and cause the nerve connections to happen again within the brain, that we can restore visual field. And let's look at another one we use, which is kind of restoring the balance to the central nervous system, which can get upset after some sort of traumatic incident like a stroke. We use this reddish color filter to balance out the central nervous system. If we're talking about misalignment of the eyes laterally, there's some filters that we utilize for that. I'm going to kind of show you what those are. And I won't go into description as to what they are used for, but here's one, here's another. You're going to see these are kind of like greenish colored. If there happens to be a vertical misalignment of the eyes, we're going to also address that. It's going to be kind of a darker blue. And in general, we need to kind of rebalance out what's happening between the two hemispheres of the brain. If the stroke occurred on the left or on the right side, then that area is going to sluggishly talk to the other side of the brain. So it can slow down things like speech and language. It can slow down thinking patterns. It can slow down like walking and moving and just processing of general information. The filter that helps us to speed up our processing ability and like rebalance the two hemispheres of the brain is going to be a kind of like nice purplish color filter, which looks just like this. And overall, if we're trying to restore eyesight or visual field and improve those things, I don't need anything for this one. It's nice and bright and yellow like the sun. We're going to use that filter. So we'll utilize Syntonics in addition to basic vision therapy, which is retraining the brain and eyes to function better as a unit, and to help to restore visual field loss if that's what happened, or to help restore alignment of the eyes if a strabismus occurred. Now, if you like this video, I'd love it if you'd hit the like button on it. If you haven't done so, subscribe to our channel. And if you know someone who happened to have a stroke, then please feel free to pass this video along. It literally could be something that changes their life forever if they are able to have restored vision as a result of you passing something along to them. And again, if you want to connect with us, call us if you're local at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can either do one of two things there, which is to schedule a consultation time directly with me, or you can fill out a questionnaire and get more information back about your vision. Thank you.